Hi there, my name is Jillian. I've been an RDH for about 2 months now. I did my internship at the Fones School of Dental Hygiene in the radiology department, and I have to say I was a little bit nervous to start there because radiology was not my strongest suit in school. But it proved to be so helpful in the process of becoming an actual RDH and improving my clinical practices in private practice. So when I started my internship, I wasn't working yet, but as soon as I started working and then I was interning with Professor Smith Alling, I learned so much from her that it made it so much easier to transition from being a student to working full time. Um, my favorite part about being in radiology was working with the first year students really closely and being able to vocalize everything that I was learning. It really made everything stick in my head so that when I was in private practice, I would think back to the times where I would have to explain to the first years what they would need to do in a certain situation. For example, we had a patient one time um, that we had to use the bisecting technique. And I was trying to remember how I was doing it in private practice, and it made it so much easier to go through it in my own head once I had taught it to somebody else. Another great experience that I had was I worked with the second year students during their lab practical for the local anesthesia comp. um, that was great because I got the opportunity to go over everything that I hadn't done in quite a while since I had been in school at Phones. So overall, it's been a wonderful experience. Professor Smith Alling was a great mentor to have. I'm so grateful. And I'll take you through radiology at the Phone School of Dental Hygiene.
Hi, I'm Sharon Smith-Alling, Master of Science, RDH. I went to University of Bridgeport for my associates, my bachelor's, and my Master of Science degree. I graduated in 2003. I went on for my master's in 2009, and I took the long route, and I graduated in 2014 because I didn't want to take summer classes.
So how long have you been an RDH?
At 18 or 19 years if we do the math. I originally started college and I wanted to be a child life worker, and that's working with children in hospitals. And you have to have an education degree with a dual psychology degree, and it was a new field back when I started, and I couldn't afford to go to that school anymore, and there was only 2 schools in the US that had it. And I paid for my own education. I came from a very large family, and I couldn't afford to go to school in Boston, and I couldn't afford my education, so I came back to Connecticut. And I always was interested in the dentist. He was my dad's best friend. We used to call him Uncle Art, and he was over all the time. So I asked my uncle, I wanted to be a dental hygienist, and he knew that we didn't have any money, so he convinced me to go to assisting school first. So I went to assisting school, and then I was assistant for over 18 years before I went back to hygiene. And it was actually my husband who decided that I should go back, because I always originally wanted to be a hygienist, and I was really upset that I listened to my Uncle Art and I went for assisting first, because then I got stuck in that rut of being an assistant for all those years. But going back as an older student, I think I was a much better student going back as an older student. A lot of my hygiene friends were educators, and so they reminded me originally when I first went to school in Boston that I was going for an education master's, and so they told me I would be a perfect candidate to be an educator. And I did really like educating my patients, and I liked school, so I did go back for my master's. And it was challenging because when I went to school the first time in the 80s, there was a card catalog, and then when I went back to school in 2000, there were everything was online, and I didn't know how to do anything online, and so it was very challenging as an older student to go to school and not know how to look up journals online. But I found that I liked the challenge of it, and so that's why I went back to get my education degree. I think my favorite part of being in the dental field is because I stayed in the same practice since I graduated, and it has been quite a few years that I've been a hygienist. I started seeing patients that were 3 years old, and I went all the way through their college years. And some of the patients that I saw when they were like when I first started and they were 6 to 8, now they're getting married and they're having children of their own, and so I see the continuation of seeing them, and then now seeing their family. I see their parents, and I just like the fact that I'm in a small community, and I really get to know my patients, and it feels like we're all a family. I don't think I would like an office that I have different patients every time they come in, and a bigger office. I don't like pushy offices where they push too much treatment. And so I just feel like I'm part of their family, and they feel the same way. When I see them out at a art festival in the summertime, they get all excited and they introduce me to their friends, and they're all excited, like, this is my dental hygienist, and it's really special. I just feel like we're all part of a big family.